Hello, my name is Rosemary. I'll be doing the CPR skill. So I have a canine that's coming, it's not breathing, so first I'm going to go on the stethoscope and see if I can get a heart rate, if I can hear anything. If I don't hear anything, then I would check the mouth to see if there's anything dislodged in there. Okay, so if I don't see anything dislodged, then I would go ahead and intubate. So I would have my ET tube, measure that, lubricate it. I'd have my laryngoscope, and so I could see inside of the mouth, and I would just and I would measure it to about like the thoracic inlet right here, like by the shoulder, and see how far that comes out to like the canine. So I put that in there. I got my puffle puff right here. Make sure that's full. I would connect to the anesthesia machine and then give oxygen, and then I would begin doing CPR. So I have a stool right here. So I have the animal kind of facing towards me, and then my assistant would be giving breaths, and then I place my hands like this, and I keep my elbows straight, and then I would do it to like the beat of Staying Alive song, or Another One Bites the Dust, or around like 100 beats per minute. So I would just do this. And I would do this for about 1 to 2 minutes, and then after, when I get to 2 minutes, I would let my assistant know that I'm ready to switch out, and then we would trade places. So assuming that like it's been 2 minutes now, okay, I'm ready to switch. So while she is giving CPR, then I'm over by the anesthesia machine, which you can't really see really well. Maybe I should get the phone. But I would start giving a breath. So I'd fill this up and give a breath, fill it up, give a breath, and then I would let the doctor and staff know as well. And then also I would have another person, another assistant that would be documenting any drugs given to the dog. And that is how you would give CPR.
Oh, let me know about your drugs.
Oh, and then this is the emergency crash cart. So it's usually right over there. So it's super close and easy to get to. And so this is what's inside of the crash cart. You got some butterfly, what do you call these, butterfly catheters. You got some 24, some 22 catheters. You got male adapter plugs. You got like IV set to give the animal fluids. You got some sterile water if you have to dilute it with the drug. And then you have this, flumazenol, antecedent. What is that, dopamine. Some more catheters and some different needle sizes. Then you have a second layer. Oh, I don't want to tip it.
Gotcha.
God dang it. Okay, it's still recording. Got atropine. Felix. Mannitol. I'm sorry if I'm saying these incorrectly. Calcium gluconate. Epinephrine. Lidocaine, 2%, some more syringes. So that's the emergency crash cart. So here's a better angle of me giving breaths to the dog. I would press this down. This would fill up with air, and then I would squeeze the bag to give it a breath. And then if on the off chance I couldn't get the animal intubated, or I didn't have access to oxygen right away, then I would use the ambu bag, which is this. And so I would connect this to the little face mask piece, and then I would hold it up to the dog's mouth, and I would squeeze the bag to give nice deep breaths. And if I did get ET tube in there, then I would just hook the ET tube up to this and do the same thing and just give nice deep breaths. And then the other thing too for the defibrillator, technicians aren't allowed to really use those, so that's the veterinarian. But essentially, like if I had like the EKG leads hooked up, I would disconnect those, and the veterinarian would come in with the defibrillator. And once that is in place and they're ready to use it, they would say clear, all the technicians back away, and they would do that. And then after the veterinarian uses the defibrillator, then I would come in with my stethoscope and I would see if I could find a heartbeat.